This is our first page if not folded. It contains the role of maxillofacial surgeon and prosthodontist as an individual, contribution of both specialists when performing dental implants, and lastly, importance of their collaboration in performing dental implants. So this section is the first one to be seen when pamphlet is folded. As you see this section, it would give you an idea about the content of our pamphlet. This area talks about what an oral and maxillofacial surgeon do and what specific cases they specialize, because there are cases that cannot be treated by other dental specialists such as cleft palates, disorders in a TMJ, and others. Oral maxillofacial surgeon are the only dental specialist that knows how to handle and treat this kind of problem. This portion talks about what a prosthodontist do and what makes them important in dentistry. This area talks about the contribution of both specialists in doing implant. The oral and maxillofacial surgeon is in charge of the patient's dental health and bone structure, while the prosthodontics ensure the longevity and aesthetic result of the implant placement. The bottom part tackles about the importance of their collaboration in doing implant, and why oral maxillofacial surgeon and prosthodontist should collaborate in doing implants, and why not other dental specialists.
So now we move on to the second page. So the second page focuses more on real dental implant cases and their feedback about how the collaboration of an oral and maxillofacial surgeon and a prosthodontist has impacted their oral health. So for the first case, here we have a patient whose last molar of his long span bridge failed, which then led for his bridge to be cut. This then needed the intervention of an oral and maxillofacial surgeon and a prosthodontist for his implants to be placed. For the second case, here we have a woman who had a drifting lower bottom denture. Despite its functionality, she had to have her lower dentures changed so that it could attach the dental implant system that she had to provide stability. For the first one, we have Miss Khan's feedback, who had her implants placed when she lost her front tooth in a dental mishap. For the second feedback, we have Mr. Grant, who had immediate implants placed to replace his teeth. For the last feedback, we have Mrs. Shelton, who had her implants placed 20 years ago when she lost her 4 teeth in her upper jaw.